It is a common and very serious medical disease with a lifetime prevalence ranging approximately between 11% in low-income countries and 15% in high-income countries. It is a matter of astonishment that the depression here, as you can see here on the screen, 15% of depression lies in the high-income countries, only 11% lies in the low-income countries. One of the reasons why it is so is depression and courage are directly related. In a low-income society such as India, I mean, as much as we boast about our increase in the economy, etc., we still are lagging behind. In a difficult country where low economic status, we are always on the fight for our survival, fight to put the food in our place or in family, fight to have a house. We are always fighting just to get into the metro, get out of the train. Everywhere there is fight. There is, I mean, we have to walk faster. We have to eat faster. We have to do everything faster. So we live in a condition where we are sort of pressurized to do certain things at certain time. Otherwise, things will go really bad, and we might not have any amount of food in our plates. So when we are in that survival mode, courage is the only option, and we deal everything with a lot of courage. We cannot say that, oh, Mumbai metros are too much congested. I will not run today. I have to run today. Otherwise, there is no job and there is no salary. So in that life pressure gives us some amount of courage to us, irrespective of if we seek that or not. So similarly, coming to the high income countries, they already are rich. All they want to do is to protect their richness. And then when you are rich, all the minute things become a big problem. Oh, mera driver nahi aaya. Oh, mera makeup ka ek ingredient छूट गया. ओ खाने में मैं ये चाहता था टर्मरिक चाहिए था लेकिन टर्मरिक आज कम डाला है कुक ने. I mean, all these silly things become very big in the minds of the rich persons, and the amount of stress and amount of worries that they feel and amount of insecurities that they accumulate in their relationships, in their personal lifestyle, over a period of time manifests itself as depression to a very great extent compared to low-income countries. Then the risk of having a mental health problem in life is about 50%, and this leads to a drop in employment, productivity, and wages. Especially with depression, I've seen that the number one thing that gets lost is the employment. They cannot go to their regular job, or even if they go, they will be thinking, they will be disoriented. They spend their life sitting in a corner. They do not want to do their job. They do not want to meet the customers or co-employees, and their productivity gets lost. And then that affects their career and their wages and their relationship with the people around them in the office or the school, college, wherever they're working. And that itself adds up to their depression. So it becomes kind of a compounding. And in other terms, it's also called as snowball effect. So how they have a small snowball sliding down the mountain of ice gets increased in its size. So depression also accumulates due to all these problems. So it is suffice to say that depression is a very serious thing, and any disease or any patient that you are treating, if you just concentrate on the depression part and just address it a little, it will help the patient to come out of his original physical disease a lot faster. Next is depression and diabetes. Depression and anxiety are the fourth main cause of the main cause, while the diabetes is the eighth cause of disability adjusted to life years. Depression occurs in 2 to 3 times higher in people with diabetes mellitus due to maybe social pressure, maybe due to lack of choice in their foods, or due to internal chemical changes happening at the neurohormone level in the brains. And many might be the cause. In which ways, depression and diabetes are interrelated. And depressive patient will not be eating on time and will not be in a position to cook meal for himself. So he would rather munch on junk foods or high sugar foods, fat-rich foods, etc., which can also become a contributing factor for the diabetes. And a depression patient will not be able to take care of himself. in terms of yoga, meditation, or exercise, whatever he is supposed to do. All this also contribute to the diabetes as well. Coming to the relationship between depression and heart disease, at least a quarter of cardiac patients suffer with depression, and adults with depression often develop heart disease. It is a kind of a ram and sham type of a relationship. One feeds the other. The depression feeds heart disease, and vice versa is also true. A patient with heart disease can become emotionally unstable because he suddenly has to think about his death. So a heart disease patient eventually can also become a depression patient as well. So 30 years of epidemiological data indicate that depression does predict the development of heart disease. So depression can eventually lead to heart disease, or we can also assume that a person with depression can get into heart disease eventually, maybe in sometime in future. And compared with people without depression, adults with a depressive disorder or symptoms have a 64% greater risk of developing coronary artery disease. And depressed CAD patients are 59% more likely to have a future adverse cardiovascular event such as a heart attack or a cardiac death. So suffice to say, if a cardiac disorder patient is coming, it makes sense to evaluate his depression status and then address it along with the cardiac disorders. And what you can definitely feel is that if you are addressing the depression along with the cardiac disorder, the recovery pace of the cardiac disease will be accelerated, is one point. And another thing is that most of the antidepressant herbs that we have at our disposal also have cardiac strengthening or antioxidant properties. Brahmi, Ashwagandha, Arjuna, Jatamamsi can be a few examples for this. Next is how depression causes heart disease. A major causative factor for depression is inflammation, autoimmune tissue damage, prolonged psychological stress, which leads to oxidative stress. This over a period of time can lead to cardiac disorders. So in a standard cardiac disease or diabetes or hypertension, etc., we talk about again inflammation, in rare cases autoimmune involvement, stress, oxidative stress, etc. And those exact causes are also related with depression as well. Depression increases the risk of uncontrolled hypertension. So after covering diabetes and cardiac disorder, hypertension, many of the reasons, many of the commonalities we have already discussed, and data also suggests that there is direct relationship between depression and uncontrolled hypertension. Vice versa is also true, and depression and obesity. And there is, in fact, there are two types of depression in which the person does not eat food at all because he's so depressed. And there is another version in which depression is sort of mixed with anxiety, which sort of stimulates pitta in a wrong way, that he becomes so hungry all the time that he starts eating more and more. And with this modern lifestyle, it is very likely for a depressed patient to eat junk foods and antioxidant foods. The depression patient turning into obesity is often called as atypical depression, and depression patient not eating food and becoming lean is called as typical. So all these things are there, and there is definitely depression and obesity relationship is also well established. Then non-communicable disease might be contributing to the pathology of depression because, like we told, oxidative stress, anxiety, autoimmune disorder, wrong immunological response, everything is very common with these non-communicable diseases and also the depression. And NCD patient with depression may need aggressive treatment for the NCD itself. So this is also very well established that if a patient with diabetes is having depression, if you are not catering to depression, if you are not attending depression and only want to address the diabetes, it would be very difficult and you may need aggressive therapies. Whereas if you divide your attention both to depression and non-communicable diseases equally, then your rate of success will go very high. And one of the problems with the depression is the insomnia or lack of sleep. And lack of sleep again puts stress on heart, puts stress on our cardiovascular system, puts stress on our total metabolic system. So both are directly related. And the therapies used for these NCDs can also help in depression also. Abhyanga, Shirodhara, and varieties of Sweda, Patra Pinda Potali Sweda, all those things, Vamana Virechana Basti, Nasya therapy. Even in the modern Ayurveda context, Acharya Charaka has not explained about depression as a separate entity at all. It is one among the Unmada Rogas only. And in the treatment of Unmada, again, Vamana Virechana Basti, Nasya, etc. are explained. So many of the therapies are common. And like I explained, many of the herbs are also common, which address both depression and NCDs together. Brahmi is a very good antioxidant, useful in, again, hypertension, and also in case of a cardiac disorder, being a very good antioxidant. Ashwagandha is, again, a very good, and most of the Pitta Shamaka herbs, ingredients of, say, Mahamanjisadi Kashayam, all are Pitta Shamaka and also useful in depression. Spices, specifically Trikatu, Lavanga, Ela, Hingu, etc., are also stimulant, not only to the body, also to the depression as well. And Jatamamsi, Sarpagandha, Arjuna, both these serve both to the causes of depression and also the non-communicable diseases. And coming to a few depression basics, I'm sorry, I'm running out of time. Persistent depressed mood, sadness, low mood, lack of interest, reduced energy. At least one of these, most of the days, at least 2 times a week. This is kind of a modern way of explaining depression. If you think that patient is not happy most of the time, that can be your scale to acknowledge depression and all. And reduce concentration, reduce self-esteem, ideas of guilt, ideas of unworthiness. Do you think that this life is not worth living? Or do you think that you are not contributing much to your work? Do you think that you are a waste body? You ask any of these, and if the answer is yes, then you have to think that it is deep depression, needing therapies, needing medicines, needing herbs, etc. And the symptoms, among the above symptoms, whatever they have explained, if it is more than fever than 4, then it is not depressed. Mild depression is between 4 and 2 from the main. There is this elaborate thing. Only thing to note is that if you find that patient is giving you hint of depression, go aggressive on depression treatment along with the non-communicable diseases is one point. And second point to observe is, if the patient is having a suicidal ideation, you have to double down. And a patient needs very aggressive treatment, because if he's in front of an unknown person like you, if the patient is opening up about his suicidal ideation, that sometimes he thinks that this life is not worth living, there are good chances that when he is alone, that these ideas can multiply in his mind, and one point of time he may also commit suicide. And so that is like a very aggressive treatment is required along with the treatment of your NCDs. So severe depression may also come up with some psychotic symptoms, where there is disorientation, person may be delusional, somebody is going to come to kill me, or my wife is not trustworthy, hallucination, somebody is talking to me, or the person himself starts talking alone when he's alone, etc. And it in itself is a very big disease. So I'm at the end of it. And there are varieties of depression like mood congruent and mood incongruent, and Prakriti and analysis, etc. I have already shared my presentation already with you all. And only one thing that I want to make the big point is that depression, when you see that there is depression, just double down on it. Do not just restrict yourself to counseling or prescribing just simple herbs. Double down on it, take care of it, and attend to it through panchakarma, upakarma, and Ayurvedic medicines. Thank you.
Awesome presentation, sir. I think we are waiting for the co-host and the yes. Okay. So anybody, if they have any questions for Dr. Hebbar, you can please request you to please put that in the chat box. And Hebbar sir will be kind enough to answer our questions. Dr. Arunima, if you're there, I cannot see you on the screen. Dr. Arunima?
Sir, actually, because of I think I am
Network
audible.
issues? Yes, yes.
No,
Okay. I
no,
think there's some network
current
issue.
cut off. But
Power
still,
supply
I
is not
want to
okay.
say some. Yes, yes. I would like to say that sir has given very nice presentation, and he is speaking about sharirik and mansik dosh. Sharirik dosh can contribute to mansik roga, and mansik roga can contribute to sharirik roga. That's the point he wants to make. And as being a Madhavbag family member, we deals on non-communicable disease, so it is very important for all of us to know about the mansik rogas, so that we can treat it as well as while we are treating non-communicable lifestyle disorder. Among the world, 60% of population is is going through depression. That is very horrible data, and especially rich countries are going through this. Means this is really very painful. Every intelligence demands its own appetite. It has its own appetite. As rich as intellectual level your becomes, that much and things you want to do in the form of new things only. Just doing your daily activity doesn't satisfy your intelligence. That's the point sir has made. That is really very wonderful point, and it is very helpful for all Madhavag's doctor. Thank you very much, sir. Very nice presentation. And I would like to invite our second chairperson, that is none other than our beloved Rahul Mandole, sir. It will be, saying anything about him is useless, but still, I will tell him that he is the person behind the research team of Madhavbag. He has presented many, article in the national and international platform. So he is the person who only not doing research himself, but also he tries that every doctor of Madhavbag should work on research basis. That is very nice of him. He put lots of effort to every single doctor of Madhavbag that they should do the research. So very warm welcome, sir. Few words from you will be very helpful for us.
Yes, thanks a lot, Dr. Arunima, ma'am, and very thanks to Dr. Hebbar, sir. Actually, it's a very important point to discuss here, the depression and non-communicable disease. And basically, without I don't want to take so much of time, because 13 presenters are there, and they will speak behalf of the entire Madhavbag team here. And I request Dr. Arunima ma'am to start with the first presentation as early as possible. Just to start with, I request all the presenters to be on time. There will be a 6 minute of time you will be having, and you have to sum up your presentation by the 6 minute, within the 6 minute. And when Dr. Anima ma'am, when she will indicate you to come to the conclusion slide, please stick to your time, come to the conclusion slide and explain what is the conclusion of your study. And Dr. Hebbar sir and I will be giving you a score 10 out of how much how was your presentation. The scoring will be based on the topic you have selected, how innovative is your topic is, how well you have presented, uh,
Watch.
and the most important thing is the evidences what you have shown, or the research question that you have taken, have you justify in your presentation or not. So over to Dr. Anima ma'am, please continue with the first presentation.
Uh, So once more, I want to welcome all of you in fourth session of National Ayurveda Cardiology Symposium. With your permission, I would like to start the presentation, and I would call first of all Dr. Apeksha Kataria. for her presentation. Please be aware of your time. I will be giving you hint on the 5th minute, and both the chairperson, please mark their presentation and send it to me privately on my WhatsApp number. Thank you. Dr. Apeksha, mic is yours.
All the best, Dr. Apeksha.
Dr. Apeksha, your time is started now. So,
yes, ma'am. Good evening to all. Myself, Dr. Apeksha Katara from Vastrapur Clinic. My case study on post-MIDCM patient with compromised ejection fraction managed by Panchkarma. 40-year male patient, recorded no any comorbidity. Before that, on 18 September, patient had complaint of chest pain, diagnosed with IHD, tropi positive, with accelerated hypertension and diabetes. 19 September, in 2D echo, severely compromised ejection fraction, left ventricular function, and severe PAH. In CAG, single vessel disease, diagonal artery, 80% stenosis. 19 September, advice for pacemaker. On 20th February 2023, patient was visited to Madhavbag for non-invasive cardiac treatment. Patient HbA1c was 7 with oral hyperglycemic agents. TMT VO2 max 9.1. Treatment protocols: IRP Pro therapy with Snehan, Swedan, and Basti. Snehan with lavender infused sesame oil, Swedan with Dashmul Kada, and Basti with Gokshur, Haridra, and Amalki Siddha oil. Also provide reverse diet kit for 60 days, which contains 1000 kilocalorie diet, high ORAC value 65,000 plus, which is directly responsible for reverse cholesterol mechanism. Low carb diet, low calorie diet, and rich in potassium and vitamin C. Herbal cardioprotective, cardiotonic, anti-inflammatory, diuretic medicines like Arjun, Gokshur, Haridra, Amalki, Vacha, Punarnava. On regular follow-up, monthly check HbA1c, VO2 max, medicine tapered accordingly and stopped. Treatment-wise, IRP Pro therapy and reverse diet kit started. This is the picture of first day patient 2D echo. And
ma'am, your slide is not moving. Only one slide is here.
1 second.
Now we can see comparative echo reports.
Patient echo report, EF fraction was 30 to 35%. After treatment, patient echo Ejection fraction was 60 to 65%. Results. There is a significant improvement was seen both flare burden, glucose tolerance, as well as HbA1c with our Panchkarma therapy, diet kit, and weight loss. Before treatment, patient weight 87.6, after treatment 84.8. Before treatment, HbA1c was 7, after treatment 6.4. VO2 max was 9.1, which is improved, and 19.6. Ejection fraction 30 to 35% before treatment, and after treatment 60 to 65%. There is a pH mild RVSP 40 mmHg. After treatment, there is no pH. Ayurvedic Panchakarma therapy, along with low calorie, low carb, antioxidant rich, was successful in reversing the pathophysiology of IHD as well as restoring optimum HB function. Patient IHD was preserved and TMT time improved while reducing cardiac. It had also helped patients with weight to attain healthier BMI. At the same time, patient HbA1c was reduced and glycemic control was established that all OHA were tapered. GHA oil basti along with tonic herbal medicines like Arjuna helped restored the injured myocardium after MI. Ayurvedic Panchakarma therapy.
Ma'am, 5 minutes are over. So
Okay,
come
ma'am.
to conclude.
Thank you.
Any question from the other person or chairperson side? You can ask. Sir Hebbar sir, Rahul sir. Rahul sir, your voice is not audible.
Okay, am I audible now?
Yes, yes.
Yes, Hebbar sir, any question or any suggestion?
Can you please show? Can you please show the actual treatment in terms of like actual medicines given for dose, etc., along with therapies?
Sir, chip 2BD. Hello.
If you can just show the slide, that will be helpful.
Can you please show the treatment slide again?
Yeah.
Yes, sir.
Okay.
Because I mean, I'm coming from externally and I do not know what are the mother specific medicine for like cardioprotective, etc. Mentioning the specific medicines would have been helpful, is my only feedback.
Yes, perfect. So,
I think we should move on to our next presentator now. If you
Right.
both the chairperson are
yes, no problem.
yes. So may I call Dr. Jeenal Thakkar for presenting her presentation. So Dr. Jeenal Thakkar, mic is yours.
Good evening, everybody.
Ma'am, I think you are running two instruments together and you have joined with two instruments. That's why this kind of noise is coming. So please stop one
Hello.
instrument.
Good evening, everybody. Actually, I have joined because of some technical issue. I have joined voice from other device. I'll be starting my screen share. Good evening, everybody. Today, I shall be presenting a 3-year follow-up of critical coronary stenosis patient, which I had started treating way back before COVID struck, and how the patient has been in continuous follow-up and her journey with me, and how Ayurveda helped her manage her disease very beautifully. The patient's journey is something like this. A 32-year-old female teacher, she and her husband run an international school in a village on the outskirts of Ahmedabad. It is roughly around more than 150 kilometers away from the city. So the patient experienced chest pain on 3rd of March 2020. And she was before 6 months diagnosed with blood pressure and diabetes. And she was taking oral medications for the same. On 3rd of March, when she experienced chest pain, she was taken to a cardiologist, and upon CAG, the patient found out that she had 75% blockages in her LMCA, and there was an ectasia also present in the LAD. So with this, the patient at such a young age was very terrified because she was suggested immediately to go for a bypass surgery, or else she was advised that she would lose her life in as less as 2 days. So with the extremely scared mindset, she and her husband were running around for understanding if there was any alternative non-invasive method which they could use for her. And during the follow-up course, when they were visiting from cardiologist to cardiologist, where they got a common opinion of having a coronary bypass done immediately, she also underwent a thallium scan, which was positive for inducible ischemia on 12th of March 2020. She visited Madhavbag from a reference source wherein somebody she knew was taking treatment in Madhavbag for diabetes in Maharashtra. So when she visited, her HbA1c was 9.6. She was currently on OHS. Since the cardiac event was very recent, I had taken her for a 6-minute walk test in which I observed the VO2 max to be as low as 3.1 only. So the diagnosis was ISD with a single vessel stenosis, and in a recently diagnosed case of DM and HTN. The treatment was something like this. We started with IRP SHS therapy, in which there was Snehan done with lavender infused sesame oil, or centripetal oleation also, as we call it. There was Swedan, or thermal vasodilation as we call it, with steam of Dashamula decoction, and per-rectal drug administration with Gokshur Haridra and Amalki Kadha. Along with this, I started her with a very specifically designed 1000 kilocalorie diet, which is very high in terms of ORAC value. This aided the reverse cholesterol mechanism and helped us reduce the plaque burden in her body. Along with this, the key feature of the diet was that it had low carbohydrates, was rich in potassium, and it is also vitamin C fortified. So this helped us reduce the oxidative stress, overall oxidative stress in the body, improve the health of her vasculature, and have very tremendous results in terms of her blood pressure and other vitals. Also used cardioprotective, anti-inflammatory, anti-diabetic medicines such as combinations of Gokshur Haridra, Amalki Haridra, and Daru Haridra, as well as since she had a long standing history of falling ill again and again, I also used certain medicines like Gunimba, Rohitaka, Kutaki, etc. to alleviate her from the symptoms similar to that of Jirnajvara. So these were the medications that were used. The treatment timeline was something like this. Each time the Panchkarma therapy was given at a frequency of twice per week. Each time when she came, the vitals were checked and follow-up was taken very rigorously. Baseline HbA1c was done. IRP therapy and reverse diet kit was started. Lipid and HbA1c were monitored monthly, and OHs were tapered accordingly. And shortly, we were successful in stopping all our OHs. In the meanwhile, I was also successful in carrying out GTT for her, which we did on 3rd of August. And we followed up that with the CT coronary angiography, which was done on 18th of September 2020. So as we can all see, the results were very remarkable. A significant improvement was seen both in the plaque burden and glucose tolerance. Her day one weight was 79.7. She managed to lose almost and miraculously we saw there was no evidence of vascular stenosis in the follow-up CTA that we did, and the ectasia was very much stable.
Ma'am, come to the conclusion.
Yeah, so the HbA1c was repeated every 6 months, and slowly she showed a decent glycemic control. No HA was restarted. But what happened was, in the last month, she was taken to hospital because she experienced a chest pain again. And the chest pain was diagnosed and treated as a non-cardiac angina, which was acute gastritis, and she was given medicine for the same. But because the patient was continuously in stress during the period of COVID, she went to a cardiologist again, who suggested that she should go for a repeat coronary angiography. And the third coronary angiography was also miraculously, we saw there was very minimal disease in her LMCA, and the ectasia, which was present since before, was very much stable. With the help of our low calorie diet, we were successfully able to reverse the pathophysiology of the plaque formation also. It also helped the patient to get stabilized into a very healthy BMI. All the medications were stopped, and there was a certain amount of lack of discipline because of the distance that she lived at. She was not able to come for regular follow-ups during the corona period. Although on the latest follow-up, glycemic control is disturbed, there was weight gain also. There was no OHA that was started again. So Ayurvedic Panchakarma therapy coupled with low carb diet, low calorie, antioxidant rich diet provide a very viable alternative in the management, long-term management and stabilization of a patient with CAD, IHD and DM. This was my conclusion. Over to you for any questions.
Thank you very much, Dr. Jina. I would invite our chairperson to ask any question if they
have. No questions. Very well presented.
Dr. Hebbar,
Yes.
sir?
Yes, Dr. Jinal, very well presented, and congratulate to you because 32 years of female patient with a 75% stenosis and LMCA, and keeping patient in 3 years follow-up, and that is well done, I think, because LMCA is area where the maximum the blood flow comes to the left ventricle, and that part was 75% stenosis, and angiographically you have proven. So just by putting the simple Ayurveda principles of I think most of you have done the Rasdhatu Chikitsa here, and you did it very well. So congratulate to you and your team, and keep the good work continue. Thank you.
Thank you, sir. Thank you very much.
Arunima ma'am, we can move to the next presenter.
So yes, I would like to call upon our next presenter, Dr. J. Spurti Narayana. Ma'am, please, mic is yours.
Good evening to all dignitaries present here and all the presenters. I'm Dr. J. Spurti Narayan, Clinic Head, Madhavbog, Batsweshwar Nagar, Bengaluru. So I'll be sharing my, is it possible to present my PPT? Okay, I'll share it. It's fine. So I'll be presenting a case study on the ischemic heart disease patient. My objective is to evaluate the effect of Panchakarma therapy in ischemic heart disease to show the improvement in MET value. MET value is basically metabolic equivalent of task, which provides a convenient method on to describe the functional
Dr. Spurti,
capacity.
hold.
Sorry.
I think there is some confusion while sharing the screen.
Is it?
Because your screen is not shared.
Is
now
it?
you have
Okay.
to enable the editing and then you start sharing your screen.
Okay. Okay.
Or else the Pallavi, if you can share her screen for Dr. Spurti, that will be also fine.
Yes, sir.
Yes, Dr. Spurti, please go ahead.
Yeah. So today I'll be presenting on case on ischemic heart disease. Next slide. So my objective is to evaluate the MET value in ischemic heart disease, wherein it helps in understanding the functional or the exercise tolerance of an individual. Next slide. So the patient of 63-year-old male who was diagnosed with diabetes in 2008, and due to the improper intake of the medicine, he lost his right eye vision in 2016, diabetic retinopathy, and also reduced vision in the left eye. And then in 2022, with the complaints of chest pain, he went to the doctor and he was asked to undergo angiogram, and wherein it was detected to be a multiple vessel CAD. And then in the same year, he was also diagnosed with chronic kidney disorder and hypertension. Later in 2023 March, he came to the clinic with complaints of breathlessness and chest pain. Next slide. So his present complaints were breathlessness on climbing, and then pain in the chest region, irregular bowels, the nocturnal micturition, numbness and burning sore, and also belching after eating food. Next slide. So these are his few investigations, wherein I've highlighted only about the heart disease. I've shown there is reduced EF, that is 45%, and then there is multiple vessel CAD as shown in the angiogram report. Next slide. So I diagnosed this as ischemic heart disease with reduced EF, and also it was associated with diabetes, hypertension, and chronic kidney disorder. Next slide. So I mainly had, I adopted the oral medication, Panchakarma, and then diet and exercise. So in Panchakarma, we did Snehana, Svedana, Basti, Hridaya Dara, Snehana with the sesame oil and the lavender oil for 30 to 35 minutes, and then Svedana with Dashamula Kada. And also we gave Basti with the combination of Gokshura, Haridra, and Amalaki Kada, and Hridaya Dara with Dashamula Kada. I will be explaining about this in detail in further slides. Next slide. Before even starting off with the treatment, I first did Koshta Shodhana by giving a very mild purgative, and then the oral medication only for the heart disease was a tablet with the combination of Gokshura, Haridra, Amalaki, and then a Kashaya of Arjuna Punarnava Vacha. Gokshura, which is again, it has nitric oxide and then it helps in vasodilation. Haridra is again anti-inflammatory. And then Amalaki itself is Rasayana and Hridya. And Arjuna, as everyone knows, it is a Hridya. And Punarnava Vacha is further. It also acts as Vaisthapana and it does Vatanulomana. Next slide. And diet, since both kidney disorder and heart disorder are like complete opposite things, and patient is also suffering from diabetes and hypertension, it was very challenging case in order to even suggest him a diet. So I had to look into it very carefully. I suggested him 1,000 kilocalorie renal diabetic diet, which was very much customized for him with the contraindications of few vegetables or fruits, and regarding even the raw intake of raw vegetables, everything. I guided him, and I was looking into the all his diet pictures through the MIB Pulse app, which we already have. Next slide. So my observations majorly, starting when he came, he used to take sorbate rates, and it was very difficult for him to walk even 100 meters. So I started with the 6-minute walk test. Day 1, his MET value was 2, and then day 90 it went up to 3.4, and the distance he used to cover was 94.5 meters, which went up to 252 meters later on after 3 months, and then VO2 max increased from 6.98 to 11.78, and later it was a challenging thing. He was not ready to go on treadmill test, but I boosted him. I took him on treadmill test, and his VO2 max came up to 29.05, and then he could walk around 12 minutes 48 seconds. Next slide.
Ma'am, come
So
to the
these are
conclusion,
few
please.
vitals changes, and with this I could also see reduction in his HbA1c, and I also tapered his medicine. Next slide. Here you can see I have tapered almost all the medicines to half of the dose, and he completely stopped sorbitrate, which he used to take weekly 4 to 5 times. Next slide. So the results, as I told you in the observations, the MET value has increased from 2 to 3.4, and there is increase in the VO2 max also. With this, I could also, good thing is I could also see the decrease in the serum creatinine levels and the HbA1c levels by tapering his medicines. Next slide. So what I would want to highlight here is the traditional class of antihistaminic drugs that we have a very good therapeutic benefit. Like in Snehana, the antixylotic, it acts as antixylotic and also reduces the sympathetic overactivity. With the Svedana, it reduces the sodium and fluid, that reduces resting preload that may happen in all class and of myocardial oxygen demand. And by use of the Gokshura, Haridra, and Amalaki, as I told you, Gokshura helps in the action of producing the nitric oxide, synthesizing, and acts as a vasodilator, and also Haridra as an anti-inflammatory, and then Amalaki as an antioxidant. Next slide. By this, the coronary circulation increases and also helps in vasodilation. Thus, I would want to conclude that Ayurvedic medicine and Panchakarma not only improve the heart function by improving the blood supply to the myocardium, there was also improvement in the symptoms, and also significantly the angina also improved, and then it also improved the overall life of the patient. He was very happy because there were a lot of changes in his normal well-being itself. Thank you so much.
Very well presented, Dr. Spurti. No comments from me. Thank you.
Thank you.
Yes, well done, Dr. Spurti. It was actually a courageous case, because I guess this patient was from the NYHA class 3 or maybe class 4 when he
Yes,
was when he came to your clinic, and the
Yes.
chronic heart failure patient with a CKD you treated very well, and
sir.
you took a courageous decision to ask him to walk on a treadmill test. So that was really courageous. What was his follow-up LVEF when you asked that patient to walk on the treadmill?
So he was like, I've never done treadmill. I'm scared of the speed that you keep
No,
changing.
I'm asking you how much was the LVEF?
Sir, that one I have to get this
Ejection fraction.
2D. Yes, sir. Ejection fraction. I had to get his 2D code done, but due to his personal thing, he's been skipping. So I was not. I tried till today morning to
No,
get his EF. He didn't go for 2D
that's
code.
really that is okay, but it's always good to be a courageous, but you have to be a calculative when it comes to your patient's health,
Yes, sir.
right? So
Yes.
unless and until 2 दिन late होगा 2D को, not a problem,
Yes,
लेकिन
sir.
we have to follow the some protocol, right?
Yes, sir. Yes, sir.
But otherwise, one more point I just like to advise or suggest you
Yes, sir.
that if you can present, if you could have present with the symptoms of your patient, what were the symptoms, and what is the improvement in the symptoms, clinical symptoms.
All right.
So,
Yes, sir.
that could have make much good
That
impact.
would.
Yes.
Yes, sir. I
So,
will take.
anyways, good presentation and keep it up. Thank you.
Thank you, sir.
Thank you very much.
Thank you, sir.
Thank you, sir, for giving us comment. I would like to call upon next presenter, that is Dr. Nishita.
Good evening, respective chairpersons and all the dignitaries who are in this session right now. Today, I will be presenting about role of mother bath HFRT treatment in PAH, that is pulmonary artery hypertension. I'm the clinic head of Mother Bath, Jayanagar, Bangalore. Next slide. So as we all know, PAH is a condition where there is increased pressure in the pulmonary artery, and this could be because of any narrowing or blocked or destroyed vessels in the lungs. And the heart must also pump harder to improve this, to reduce this resistance that is coming from the pulmonary artery. And it is considered as PAH when the pressure is more than 25 mm of Hg, and when there is no other reasons to cause this PAH, where there is no underlying lung disorders, then it is mostly considered as idiopathic. And most of the cases of PAH turn out to be idiopathic because once the lung disease is taken care of, the PAH goes down. And right now, there is no treatment for PAH except for giving them oxygenation additionally or by providing them bronchodilators. So the objective of the study is to ultimately give relief to patients who are suffering from PAH and to prolong their life and their quality of living. So when PAH is untreated, it ultimately leads to heart failure. The right side of the heart fails, and that is when the symptoms of heart failure sets in. So unfortunately, today, modern science sees cardiology as a different entity and pulmonology as a different entity. But here the objective is to prove that they go hand in hand. Next slide, please. So this is about a case which came to us. It is a case of a 75-year-old female who was moderately obese. She's about 34 kg per meter square was her BMI. She was a homemaker, leading a very normal life. Next slide. Doing all her household chores, everything was normal until 5 years ago when she experienced dizziness, and on further evaluation, PAH was diagnosed and cardiac involvement was ruled out through 2D echo and NT-proBNP investigations. So during that time, oxygenation was advised for 12 hours per day along with certain bronchodilators. And then 1 year ago, just as a random checkup, when she did 2D echo, she got to know that she has severe aortic valve stenosis. And last year, in 2022 November, the condition worsened with increased fatigue and breathlessness, and she was suggested for 20 hours of oxygenation. And her concern as to why she approached Mother Bath was to reduce her breathlessness, fatigue, and dependency on oxygen and to lead a quality life. Next slide. So this was an X-ray that was done to rule out any lung issues if it was involved that was leading to PAH. So the lung results turned out to be normal, and she had nothing to do with the lungs, and it was confirmed as idiopathic PAH. Next slide. So this was the 2D, NT-proBNP test that was done initially 5 years ago, where it was 283, and then later when it was done in November, 2023, where the condition had worsened and she had gone into heart failure status, where it was 3,961. Next slide. So these were the present medicines when she came to us. She was dependent on 2 types of inhalers and then tablet doxy every day on an OD dose, and her hypertension medications. So was 0.3 or in the night and Taslog 40 in the night, and she's been hypertensive for the past 20 years. And here we planned HFRT treatment for her, keeping that mostly in mind to reduce the symptoms that she was facing. So we did centripetal oleation with Arjuna oil, thermal vasodilatation with Dashamula decoction, and Hrudyadhara with Dashamula decoction, and PRDA with Arjuna and Punarnava decoction. So orally, medicines were mostly given to reduce the fluid load over the lungs and the heart through Punura, and to improve the cardiac muscles, Arjuna was chosen. And also vitamin C rich diet was what was advised to her to improve her immunity, to improve the ORAC value, and to improve that anti-aging effects in her. So to boost that, vitamin C rich diet was considered. And this was the improvements that we noticed in her. Before she was 74 kg, she didn't do the diet accurately as insisted. So weight dip was very minimal. Her oxygen dependency from 20 hours went to 12 hours, and her SpO2 at rest was anytime between 84 to 88%. Now she walks around and comes around, say, with 92, 96% of SpO2 in rest. And her blood pressure, which was consistently 160/80 by 100 to 110, has now come down to 120 to 140 or 80/90. And NT-proBNP from 3,961 has dipped to 258, and PASP from 60 mm of Hg has dipped down to 45 mm of Hg, and her VO2 max has improved from 5.78 to 10.58. And these are the improvements that you can notice in her PASP values. 60 mm and now 45 mm of Hg, and the NT-proBNP reports before and after. So how is our therapy helped? Basically, the antioxidant-rich diet that we gave her
Come to conclusion, please, ma'am.
has helped her to improve her condition, prevent the anti-aging that was going on, and the centripetal oleation and vasodilation has improved the elasticity of the blood vessels, reduced the pressure, and reduced the peripheral resistance in the vessels, and this has decreased the pressure in the arteries. And PRDA with Arjuna, as we all know, it is having a potent coenzyme Q10, which improves the immunity, also acts as an anti-aging and cardioprotective in nature. And this has acted as a diuretic with Punarnava, which has reduced the fluid load on her. And breathing exercises, pranayama was encouraged in her. Ballooning was asked to be done, and this improved her lung capacity and oxygenation. And conclusion is that Ayurveda mentions Pranavaha Srotas Mula is Hrudya and Rasavahini Dhamanis, and Hrudaya is also Rasavaha Srota Mula, and hence symptoms like Shwasa is noted in both of these conditions. But today, cardiology and pulmonology go hand in hand, but none of them are ready to understand this. And so takeaway is that Madhav's HFRT is a promising therapy to reverse idiopathic PAH, and there's a hope for such patients to improve their quality of life and lifespan with HFRT, and now can be confidently advised to such patients with idiopathic PAH. Thank you.
Thank you, Dr. Nishita. Very well presented. I would like to ask if any question is there from chairperson side or anyone.
Nothing from my side. Very well presented.
Thank you, sir.
Yes. Dr. Nishita, very well presented, and congratulations. Reversing the pulmonary artery hypertension like chronic problem, it's commendable job. I have a question that have you observed any relapse after discontinuation of a treatment?
No, sir. She is actually still in treatment. So this was the report done after 17 sessions. So she's still continuing with us. She is still left with 3 more sessions to go. And post that, I'm expecting more improvement.
So any further improvement is noted? So
definitely, sir. Initially, when she was coming, I suggested her to carry her oxygen concentrator to come to the clinic, because we were really scared to treat her without the oxygen, making her lie on the table for one and a half hour continuously. But just 2 sessions, she bought it with her. And then after that, she's very confident. She comes on her own. Earlier, we used to ask the family member to accompany her. Now she comes all by herself and goes back by herself. Very marked improvement, personally, what she's experiencing. And today I have demonstrated only the objective parameters that have improved. Subjective, she's very happy about it.
Great. So congratulations once again and very nice presenter.
Thank you, sir.
Thank you very much, Dr. Rahul, Dr. Nishita. Now I would like to call our next presenter, that is Dr. Shweta Sarade. Ma'am, please, mic is yours.
Hello.
Yes,
Good
ma'am, you are
evening.
audible.
Yes. Good evening, all. Today I am presenting my subject is the role of the Ayurveda-based ischemic reversible program in management of ischemic heart disease with the patient in terms of Duke score and the VO2 max improvements. Next. Myself is Dr. Shweta Sarade as a preventive cardiologist from the Solapur Employments of Madhava Clinic. Here is the PPT showing that the total 25 patient study here is present that the against the spikes present the Duke score, METS value, and VO2 max, that is the heart exercise tolerance capacity improvement after the treatment of Ayurveda, that is the Panchakarma therapy and the diet therapy. Next. From that 25 patient, one single case study I present here. As the patient age is 58 and post CAG and post PTCA patient present in the clinic with the dyspnea 1, angina 1, and also the complication of edema and chest heaviness with anxiety and palpitation. This symptom is present on the first day. Next. With the investigations I do in the clinic, that this stress test is positive on the 4 minutes after PTCA. Also is EF is 70 with the regional wall motion abnormality, and all blood investigations done. There is no thyroid, KFT, LFT also normal, and patient is non-diabetic. Next. After treatment, patient's stress test is also done, 15 minutes completed, 2 week also normal, and all blood tests are also normal. Next. So patient is diagnosed as ischemic heart disease first of all, and then I treated. Then the treatment first day, patient is on the antiplatelet agents, nitrate, muscular relaxant, potassium channel blockers, beta blockers, and antacid. After treatment, patient has no allopathic medicine with also no Madhava or Ayurvedic medicines. As the parameters are the before treatments are the VO2 max, as that is the heart exercise tolerance capacity is the 14 ml, MET value is the 4, and Duke score is the only 1, and heart rate is 98 or 100. It's the patient is land up in sometimes in tachycardia also. After treatment, VO2 max improvement is seen here. The 35.35 ml MET value is increased up to 10. The Duke score is also improved up to 10.9. Heart rate is settled down without medicines. Next. So this is the treatment is the Ayurveda-based research-based treatment depends mostly on the research-oriented high ORAC value diet is given to patients, and experts-oriented customized exercise plan for lifestyle modification and the changing in the our circadian cycle also. So here is the present with the what type of the high ORAC value or diet. That's why I given the patient is. That means that the Madhav Raj, Chavanprash, cardiac tea, Rajma, flour, soya, all contents are here. The atta that's made from the barley, which contains all 1000 calorie diet daily, or that is the high ORAC value is the more than the 6500. So concept of reverse diet box is here. This is specialized design for the heart disease and blockages patients based on the high uric value, that is the 1000 calories with the carbohydrate percentage only 40%. Protein is the 20% and good fat that without trans fat is the 20%. That is the more efficient diet for the patient. Next. So content of that's already explained. Also here is the cardiac tea breakfast is something. The concept of the reverse diet is the based on the this is the ROS yani ki free radical inflammatory cascade is present in our patients blood vessels that reduced by the high ORAC value or diet based which we give in the treatment is the major role of the treatment is the this is the reverse diet kit. Next, the how can reverse diet kit acts on our system or atherosclerosis that explained well in this PPT. That's ROS, that the free radicals are the main cascade that the endothelium will damage now. After the introduction of the reverse diet kit or higher ORAC value diet, the patient's endothelium damaged is reversed back and all the parameters after treatments that seen before that achievement is after that's only. And after within a treatment diet is the main role. Also is the Ayurvedic
Come to conclusion, ma'am.
Is also is the play the main role. And also the Snehan Svedan Basti is the doing the herbals are including that. The Snehan included the Abhyanga Tel, the lavender oil. So Svedan is the Shmul Kada and Basti is the GHA Vokshur, that is the Haridra Vokshur and Gurmat. So next. So before treatment, after treatment, do score that the before is the 1 of and after is the 10.9. So look score when the patient is the look score is -11, then the at the high risk do score is between the -11 to 4 is the patient is at moderate, and do score when the more than 4 is the patient is at low risk. Hence, after the treatment of Madhavak or Ayurveda treatment and the high ORAC value diet base, the here is we see that the do scale improved from 1 to 10.9. That means the patient's risk of mortality is very much reduced due to the modification in the diet and lifestyle and the panchakarma therapy. So I conclude that that the Ayurvedic treatment, systemic reversible treatments or Ayurvedic treatments and the high ORAC value based diet and customized exercise. The exercise is the key changer of the patient to improve the life score of them. So hence I conclude that the Ayurveda is the best treatment for the ischemia reversal. Thank you.
Thank you very much, ma'am. Any question from the chairperson side, please?
No question from me.
No question, just a feedback that the slides can be better. There were some mistakes in the spelling, etc. And also the presentation should be such that we do not put effort to hear properly the whole narration. It should be easy for the audience, is my favorite.
Okay,
otherwise,
sir, noted.
very well presented.
Okay, noted.
Thank you very much, sir. Now, with your permission, I would like to call next presenter, that is Dr. Swarna Timare, ma'am. Ma'am, mic is yours. You can start your presentation.
Yes, Dr. Suvarna, ma'am.
Yes, yes.
You can start your presentation.
Yes. Good evening, everyone. Myself, Dr. Suvarna Tirumalin, have been practicing in Madhavbag Karad clinics. My case is role of Shirodhara in improvement in HTN as well as in facial palsy. Next slide. Role of Shirodhara. To evaluate, my objective is to evaluate the role of Shirodhara to improve facial palsy in hypertension disease. So before slide, this patient, medical history patient is a 45 years old age, male, female patient, blood pressure since 3 years. Now, before 2 years back, he had got a 2 episode of facial palsy in 2 years back. Investigation already patients have done to CBC that has HbN 12.7, total cholesterol. As you see, his in lipid profiles, the triglyceride is going to 336 in range. Next slide. Case detail, present complaints, patient have complaints with the blurred speech, weakness, irritation, and disturbs in sleep. Patients having HTN since 3 years, but now complaining about blurred sleep and sleep disturbance. In examination, I have found his blood pressure is going to 150 with 70. With asymmetrical mouth movements, incomplete eye closure, right side dropping of mouth, and facial weakness. Next slide. Treatment given in Madhavbag, that is HTN Panchakarma therapy. It includes the Snehan Sedal, that is the centripetal oleations, which is going to rose oil for Snehan. Swedan is Dashmul Kada for Swedan. It controls the thermal vasodilation. Shirodhara, in Shirodhara, we use the Jatamasi Kada. Next slide. In oral medications, we have to use Sunti plus Brahmli, Amaliki plus Haridra, Guruji 2 capsules BD, Brahmi, Shankar, Pushpi, Jatamasi into BD. Diet is OBP diet, that is 800 kilocalories diet given, high fiber, high protein, low carbs. In exercise, 45 minutes early morning walk, pranayam and meditation. And especially, I have instructed to do the patients before going to bed. He had advised to compulsory doing the pranayam and meditation for 15 to 20 minutes that have supported to blood pressure in early morning blood pressure in control. In medicine, Sunti works as anti-inflammatory, antidepressants, sedatives, antioxidants, and calm the sympathetic nervous system. Brahmi is also used as the calcium channel blocker activity as well as nitric oxide medications, vasodilation activity. So it causes the relaxation of CNS and reduce the peripheral resistance and cardiac output. So it will therapies going on as well as improve the hypertension and facial palsy also. In Shirodhara, I use the Jatamasi Kada that helps to involve the rhythmic and consistent flow of lukewarm oils for any medication liquids on the forehead for at least 30 minutes. According to the Shirodhara therapy, induces potent vasodilator effect on the body and it helps the dilated blood vessels and helping blood circulation throughout the body. It is beneficial for HTN as well as in facial palsy. In timeline, patient came on first day with their complaints, starting panchakarma and oral medications, advice, exercise and diet, later adding the yogasans and meditations in that. Later on adding the Shirodhara treatment plan. After that get much relief on the symptoms. After 6 months, all symptoms of hypertension and facial pulse was reduced. ABPM that you have to conduct and stopped all allopathy medicines. The ABPM comes to negative, no induced hypertension showing. Results, next slide. In result, the patients before weight 61.8 reduces to 59, BMI is 24 going to 23. Especially if you are seeing the triglycerides which was in 380 ranges, it will come back to 136. And now the patients who has having the one side mouth dropping and blur sheet. Now the patient has no complaints, staying ABPM negative. Actually, madam, a patient's face is not revealed in this PPT, so I can't reveal his face. But if you are saying interested, the patient's before and after facial picture is so different. Now, after our treatment, patient has got marathon second prize in his area, and he is fully confident. He's even mouth speech या फिर eyelids जो openings जो में धीरे होती है उसमें से बहुत कुछ improve हुआ है. So conclusion is that the Shirodhara treatment, it helps to improve the blood pressure as well as in facial pulsing.
Very well presented, Dr. Swarna. You have taught us lesson that we can also teach facial palsy by this treatment. So that is very innovative. I would like to ask if any question is there from chairperson side. So please, sir, go ahead.
Thank you, madam.
Because it is a scientific research presentation, even in terms of like meditation and pranayama, if you're mentioning what specific type of meditation and pranayama is mentioned, would make the treatment protocol very clear so that we understand this was given to get this result. That's one feedback. And I come from publishing industry, and so I had to make this point that there are too many spelling mistakes, and simple Microsoft Word spell check or even with Google Docs spell check would negate that. This is just a feedback to improve with your future presentations. Otherwise, congratulations for the treatment success that you had.
Thank you.
Yes, Dr. Suvarna, congratulations for your results and outcome, and all the best for your future presentations. Thank you.
Thank you very much, ma'am. And Hebbar sir, we will keep your point in our mind. And yes, thank you very much for pointing that out. And we'll keep learning. Knowledge is the key to success. So we will keep learning. So I would now call our next presenter, that is Dr. Deepali Veswar, ma'am. Deepali, ma'am, mic is yours.
Should I share my screen? Should I share my screen?
Yes, please. Yes, you can share.
Good evening, this is Goa Marga Clinic, and the topic of today's presentation is clinical efficacy of alternative therapy in heart failure disease management. Can you see my next slide?
No, ma'am, your screen is not visible. Only black color is showing up there. Slides are not visible.
Slides are not visible?
Yes. Pallavi, ma'am, if you can help her, then please.
Yes, can I share?
Yeah.
Deepal. Yes. Now your slides are visible, but you have to make it in presentation mode. Yes, Deepali, ma'am. Now you can go ahead.
Next slide. Yeah, next slide. Yeah, so as we all know, heart failure, basic heart failure is a long life condition in which the heart muscles are unable to pump the enough blood supply to the body's demand and the need. And so that is why it is a chronic and a long-term disorder which stays with the patient and has a long-term impact on his quality and quantity of life. So basically the aim of the study was to see that the alternative therapy, which here I have proposed as a heart failure reversal therapy, can do and help the patients suffering from heart failure in improving their quality, in managing their health parameters in the terms of improvement of their quantity of life, and getting them out of the recurrent recurrent hospitalizations and the expenditures on the hospitalizations. Next slide. So here the sample size which I have selected is 30 numbers, and the study here is an observational study. The duration of the study was between March 21 to December 22, and the inclusion criteria was the NYHA 3 and 4 are included into this study. The LVF who were 45 or less than 45%, the NT-proBNP more than 300, and the age is less than 80 years. The exclusion criteria was the patient who were having a MI in the last 15 days or a hospitalization due to acute heart failure, or the patient who were in medical devices like pacemaker were avoided. Next slide. So the assessment parameters were assessed on a day 1, 30, 60, and 90, and the assessment parameters were the distance which were covered in the 6 minutes walk test, as the patients which were included were in a NYHA category grade of 3rd and 4th. Then the VO2 max was assessed, and the LVEF percentage and the NT-proBNP levels were assessed. Next slide. So here in treatment protocols, as I'm proposing, my alternate therapy treatment is a heart failure reversal therapy, which is a panchakarma based therapy in which the 4 treatment procedures were done, like centripetal oleation, thermal vasodilation, thoracic drip, and per rectal drug administration, in which the core line of treatment here I am considering is the heart failure reversal panchakarma therapy. Along with that, the patients were advised for a low salt or restricted diet and the low volume of fluid intake, which was somewhere as per the BMI starting from 800 to 112 kilocalories. Next slide. So while observing the result in the observational study of the 30 patients in this course of duration, we can find that there was a significant improvement in the 6-minute walk test, which was in an average mean ratio of all 30 patients from 62 meter to 156, and in the VO2 max from 6.38 to 8.78. The LVEF was improved by an average of 4%, and the NT-proBNP was improved by an average of 122. Next slide. So here, as we can see that there was a significant improvement in the parameters of the patient, but there was, yes, also a limitation in the limited size of population and the limitation in the study. But still, we can have a strong opinion about the results which are coming up and can be more significantly correlated with the further studies. Next slide. So, on the basis of this study, we can strongly say that the patients of heart failure can have a good amount of significant quality and quantity of life, and can have a reduction in their morbidity and mortality. And the alternative therapy in the form of Ayurveda, which is come up with Madhav Bagh in the form of a heart failure reversal therapy, can be one of the potent options in management of the heart failure disease. Thank you.
Thank you. And because it was not just a single case study and multiple patients were involved, a statistical analysis and the display of the result therein would increase the quality of research and brings in more authenticity, is one point. And if we are using the term reversal, I mean, as an outsider or as a neutral person, I would think that only if the patient is maintaining as is without even using single medicine, maybe the diet and lifestyle is part of the patient. We cannot. So that part
yes,
is
sir,
good
the
enough.
diet and the medicine is integral part of the treatment, along with the allopathic and our. But in terms of the therapies which we are giving, could improvise significantly their quality and quantity of life.
No, I mean, I'm just making a general statement that if you are using the term reversal, we can claim that it is reversed only if the patient is stops taking any medicine or
Yes,
any external intervention. Just with diet and lifestyle is maintaining, then that becomes the definition of reversal. Otherwise, very well presented. Thank you.
Yes, absolutely right. Hebbar sir has rightly pointed out the point that when we say a reversal on a scientific platform, we should have that much of evidence backing the word reversal. Otherwise, we should not
Yes, sir.
use. But all the Dr. Deepali, very good presentation. The first time I have seen the 13 patient data compilation you have tried to analyze. But if you can take me to the result part, the slide where you shown the result part, I think you just statistically analyze the VO2 max part,
Average
right?
mean ratio.
Ah.
The 6-minute walk test, VO2 max, LVEF, and NT-proBNP.
But NT-proBNP, you have just shown what is average reduction in NT-proBNP, and that is also 258. That is not what I'll say the up to the mark level, right?
Okay, sir.
Because you haven't applied any statistical t-test to make
Yeah.
claim that you have reversed the NT-proBNP as well, right? So we should take care of that part, as Dr. Hebbar said. At the end of the day, what I'll say is a very good presentation, but that can be a better if you can follow some that statistical significance or the good presentation skills. That's it, nothing else.
Okay, sir. Yeah. Thank you.
Thank you, sir. Now I would like to call upon our next presenter, that is Dr. Tanvi Jadhav. Tanvi ma'am, unmute yourself.
Hello. Good evening to all dignitaries and my dear doctor friends. Today I am going to present a case. My name is Dr. Tanvi Jadhav. I am currently working as a clinic head in Satara Diagnostic Clinic. My topic is role of Anvas and Basti in improving the VO2 max of a IHD patient. It is a single case study. Actually, IHD means, as we all know, that it is an imbalance between the demand of oxygen and blood supply of the heart muscles. And VO2 max is the requirement of oxygen consumed by the heart muscles. So it is a simple study of this concern point in IHD patient. Just I'll let you know the history of patient. The patient was male patient, 62 years old. He came to the clinic with the history of diabetes and HTN, hypertension. He was suffering from just a depression mode because he lost his wife before 2 months, and he was completely not willing to live further. So that was his very critical point that we have to take into consideration. Suddenly he got that MI, acute MI. He suffered from acute MI and he was hospitalized for that MI. Then he was thrombolized. He was detected in CAG with multiple blockages. As I mentioned, he was detected critical TVD, LMCA 50% stenosis, LAD 90% stenosis, LCX, OM1 95% stenosis, OM2 70% stenosis, RCA 70%, tubular 90% and PDA 90%. So there are multiple blockages were there. So he was again more in depression phase, as he doesn't want to go for bypass surgery. Then he came with the wish that is there any possibility to live ahead, or is there any possibility of better life ahead? That was his main concern to reach Madhobag. So we started with our treatments, ischemia reversal program. Here we decided to give him combination of medicines plus diet plus panchakarma therapies. In September 2022, we started the actual treatment. His current complaint, at present his complaint was chest pain at rest. It was the major complaint, and he was just feeling generalized weakness. Then investigation we did further was ECG, 2D echo with GLS, lipid profile, HSCRP. As he was the patient of stable angina, we couldn't go for stress test. We have conducted the walk test and HbA1c. Next, please. The patient was diagnosed as IHD with critical TVD. Next, please. As I said, we used a combination of therapies. So we used oral medications, the combination of drug that contains the Gokshur, Haridra, Amalaki, and it was given in Vyanodan Kal, that is after the meal in BD dose. Then we have asked him to follow the high URAC value diet, which was customized diet for him, and we used to recommend him. And then again, the Panchakarma part was that we have planned to given the 21 Anuvasan Basti sittings, obviously followed by the Snehan and Swedan. But here we faced one issue that the patient was not willing, as he was suffering from depression, he was not willing to have that particular design diet because it was quite not palatable for him, and he was not at all willing to start, and he was having the food in time. So that was our main problem, that how to cover him from his depression. So we took counseling sessions almost weekly, twice for him, and just for initial 5 days we have given some Pachan treatment for him, and then we have gone for the actual Anuvasan Basti treatment. Next slide. Ma'am, next please. Okay, then we have checked as this his depression counseling sessions were going on, so we took a bit more time in completing the treatment. At the initial stage, his BP, cholesterol level, all things were out of normal range. Then when December, after 3 months, when we rechecked the things, then BP was near to normal, but not completely. Lipid profile was below normal range. Stress test we could conduct, because initially we were not able to conduct the test, and at that time he was able to walk for 9.30 minutes. So his VO2 max was 17.5 ml per kg per minute. And after 3 months, again we continued the same Anuvasan Basti and same counseling sessions. So now he was following the diet also, some exercise schedule also. So he was out of depression. So that's why his VO2 max is raised up to 25. And finally, we have
to conclusion, ma'am, please.
Yes, ma'am. So multiple vessels are having stenosis. That means the stiffness of endothelial layer, showing that the atherosclerotic changes, thus reducing the blood flow to the cardiac muscles, ultimately reduce the oxygen carrying capacity of the heart muscles, reduced VO2 max. So this combination of lifestyle, dinacharya, exercise, pranayam, meditation. So all these things we togetherly work out for increasing his VO2 max. And we use cardioprotective medicines also, which improves the endothelial function, strengthen the heart muscles, and also the diet helped a lot. Next slide, please. As the Anuvasan Basti plays very important role in reducing the stiffness of coronaries and vasodilatation, which ultimately increases the coronary reserve, reduces the peripheral resistance by strengthening the heart muscles, and improves the cardiac output by raising the VO2 max. Thereby it is reversal of ischemia. By reversal process of ischemia, we can improve the tolerance capacity of heart with improvement in CAD. So now the patient is willing to leave ahead, and he is 90% out of depression, and he is now like a mentor for our other CAD patients. So he's doing very well now. Thank you so much.
Any questions, sir?
Thank you, Dr. Tanvi. Very well presented. Yeah, at least the depression part came, so I'm very happy with that. And with just one point, it's not related to your presentation, is that in a patient depression, in a case of depression, especially when the patient has lost some beloved person in his family, or say he has met with a road traffic accident and he has some PTSD, we should be very careful while introducing the meditation part, because he will not be able to cope up with that. And even in terms of like in Hindu custom, if someone loses the near and dear one for 13 days, he's not he's not allowed to, or he's not allowed to do any puja at home, so that he gains back his mental alertness first, and his conscience is in the right place, and only then he is given the access to puja and other things. Just a point. And thank you, Dr. Baswati ji, to present, guiding us with all the feedback. Really appreciate. And I personally have one counter for the pronunciation, is that it's not that much important is this one. And I think the English as such needs upgrade. English language needs upgrade to accustom our Indian presentation. So I do not have, other than that, rest of good feedback. We always welcome your. I mean, I wonder how much energy that you get, that you present throughout the presentation, and continuously giving all the feedback. Thank you very much, Dr. Vasatiji.
Yes, sir.
Yes, Dr. Tanvi, it's one of the best presentation of the evening, I guess, and very well presented, topic covered very well, basically. Next time I'm expecting the few more cases, because this was just a single case, and so we cannot make a tall claim from the single case, but still a very good attempt and very well presented once again. Thank you.
Thank you so much, sir.
Thank you, sir. Now I would like to call upon Dr. Lakshmi Narayan Sarbare, sir, for next presentation, please.
Yes. May I start, madam?
Yes, sir. Please, we are waiting for.
Good evening to all. Myself, Dr. Lakshmi Narayan Sarbare from Chandrapur Madhava Clinic. I am presenting today cohort study. My research topic is to evaluate the efficacy of hypertension management program along with sodium and calorie restricted diet on elevated blood pressure and nocturnal BP in elderly patient with hypertension to reduce risk of cardiac event. Objective is that hypertension is the leading cause of the global burden of cardiovascular disease. It is an epidemic that globally affects 1 billion people and a common cause of death. WHO statistically 2019 said that the global prevalence of hypertension was more than 30%, in India 29.8%. Across the world, hypertension is responsible for 15% of cerebrovascular disease and 45% of ischemic heart disease death. Introduction: blood pressure follows diurnal BP rhythm and circadian rhythm with 10% to 15% lower values during nighttime than during daytime. The absence of nocturnal BP decreases, that is dipping, is associated with the target organ damage. Nocturnal BP is a significant risk factor for mortality and cardiovascular morbidity, cardiac hypertrophy, and silent cerebral infarction, renal failure, etc. Reverse dipping and extremely unphysiological diurnal variation of BP may be a marker of poor health rather than a cause of it. There are many reasons for non-dipping, reverse dipping in hypertensive patients. Sympathetic nervous system contribute major role in dipping. Methodology: this is the observed respective type. Center is Madhava Clinic, Chandrapur. Study period is March 2022 December 2022. Sample size 20. Inclusion criteria: patient age 18 to 75. This is the trial done on basis of ambulatory blood pressure monitoring. ABPM is diagnostic stage to determine the presence of hypertension. ABPM is better predictor of hypertensive target organ damage than blood pressure measured in the clinic. Studies with ABPM have also documented that there is a marked diurnal variation in BP and circadian fall in the nocturnal BP. Include night dipping BP is most important to diagnose risk of cardiac event. Various procedure we are using in this therapy. There is Snehan, which reduces sympathetic overstimulation, improves vascular tone. Sedan, which reduces systemic vascular resistance. Shirodhara, in which we use Jatamas decoction. It provides complete mental challenge relaxation. It induces calmness and helps reduce stress. It provides complete mental well-being, promote healthy way. Along with the therapy, we use Gobi diet box, which is a sodium and calorie restricted diet for blood pressure management. concept of that going diet was low calorie diet. That's 1000 kilocalorie diet, low sodium, low carbohydrate, high fiber, high protein, good quality fat, rich in magnesium, high antioxidant capacity. Along with we use add-on service as a MI Pulse app. With diet BP monitoring with MI Pulse app, we regularly ask patient to send his thali photo with blood pressure regularly monitoring. We use this study. We have taken 20 hypertension patients were enrolled in the study. Out of this, 11 are male, 9 were female. Age group is 48.75 average. There is significant improvement in systolic blood pressure, diastolic blood pressure, nocturnal BP, and BMI. Again, result is that in this systolic blood pressure of significant improvement in 4.7 from baseline 127.3 to 124.6, and this systolic diastolic BP it is of 4.3. Night systolic blood pressure of 14.85 and night diastolic blood pressure is of 5.35, which is extremely statistically significant improvement. And nocturnal dipping in blood pressure of 8.40, that is from baseline 3.22 to 11.62, which is extremely statistically significant. P-value is 0.0001. BMI of 2.08. There is a significant tapering of allopathic medicine, that is of 80% tapering. Discussion, there is a significant improvement in systolic blood pressure, diastolic blood pressure, BMI, and heart rate of all patients after hypertension management program is restricted sodium and calorie diet. Moreover, extremely significant improvement in night dipping blood pressure, that is by 8.40, along with 80% reduction in allopathic medicine. These are noteworthy good result of hypertension management program, Panchakarma treatment, and restricted diet program. This discovery is especially significant for population like those in India, where unfavorable side effects and higher treatment costs, significantly lower compliance and adherence, raising the risk of hypertension complications. We humbly advise further research with bigger sample size and longer follow-up rate so that the result of our study can be confirmed and extrapolated to larger population. Conclusion, thus we can conclude that an Ayurveda-based hypertension management program along with sodium and calcium diet can serve as a treatment for patients with hypertension. Since is significantly improved systemic blood pressure, diastolic blood pressure, BMI, and nocturnal dipping, which can reduce risk of cardiac event, reduces allopathic dependency, which is an added benefit. Thank you. This is our team. Thank you to Rahul sir. Thank you, Gurdutt sir, Omkar sir, Aman sir, Suhas sir, and all team and all delegates.
Thank you very much, sir. This was a wonderful study. Any question from chairperson, sir? Right.
No questions, sir. Very well presented, sir. Thank you very much.
So, Dr. Lakshminarayan Sarbere sir, I guess this is the presentation I was waiting for, because the study, it's a retrospective observational study, kind of research study you have conducted in a very small town like a Chandrapur, where you have studying the patient for a nocturnal dipping. Earlier session, Hebbar sir and all the senior chairperson has pointed out the importance of dinacharya and the importance of sleep, how much sleep is important, because this nocturnal dipping is actually indicating the ongoing atherosclerotic changes. There are several research are still published. The Asteroid trial has already said that the nocturnal dipping and hypertension can be a very fatal on a long term, and you choose your research topic very well. You executed this study while doing your clinical practice, and I have seen all the statistical parameters you have used across all the parameters or the variables that you have used. So hats off to you. And so it's very inspirational actually कि आप चंद्रपुर में आपने ये study conduct की है and you are presenting it on a global platform. And it's very inspirational for all the Ayurveda practitioners. It's very beautiful. I think any cardiologist, if he see this kind of a presentation from a BMS graduate, he will feel envy of you, because even they may not have the 24 hours of ambulatory BP data with them. And excellent, sir. You make us feel proud. Thank you.
Thank you, sir. Thank you very much.
Excellent, sir. I would also like to add key every time you present cohort study, that is very wonderful point. And every time chairperson used to say ki present, please focus on the p value, and you have given us that. So yes, there is a lot to learn from you. Thank you very much, sir, for showering us with knowledge. And let's move to our next presenter, that is Dr. Nidhi Shahare ma'am.
Am I audible, ma'am?
Yes, you are audible.
Yes,
you are audible. Pallavi ma'am, please share the screen. Yes, ma'am.
Yeah, good evening, everybody. Myself, Dr. Nidhi Shahare from Adabag OPD, Brahmapuri. And my today's case presentation is management of avascular necrosis, left femoral led by Ayurvedic management. Next slide, please. Avascular necrosis of hip joint has emerged as one of the most disabling conditions of person. It poses a challenge in front of medical fraternity due to non-availability of accurate management for this condition. Surgery offers hip joint replacement that is not so commonly available and expensive too. So my objective is role of Panchakarma modality, which is correlated to AVM. Next slide, please.
Ma'am, there is some network issue.
Yeah, here is the main patient. Yeah, here is a male patient, 43 years age. He had come with radiatory pricking type of pain at left hip joint in the month of December 2022. 1 year prior to that, he had history of blackish discoloration of skin of lower limbs, for which he had underwent treatment under skin specialist and got cured. He had no history of fall or accident. In month of March, I asked him for a CT of hip joint and lower lumbar spine. And in the month of April, he got treatment under Madhava and got symptoms were relieved. Next slide, please. Yeah, this is the CT scan of the patient.
Ma'am, your voice is not audible. I think you have lost again internet connection. Is that so?
Dr. Arunima ma'am, if the next presenter is ready, then
yes,
we should
yes.
move to the next presenter, because
yes,
already we are running out of time.
Yes, definitely. We'll move to our next presenter, and that is Dr. Gauri Tarwar, ma'am. Please. Meanwhile, Dr. Gauri is presenting her paper. I would like to say that we are almost at the finishing point. Only 2 presentations are left. So it will be easy for me if a chairperson can send the marking at my personal chat. So I will calculate meanwhile.
Good evening. Hello, am I audible?
Yes, you are.
Good evening to chairpersons and all the presenters. Myself, Dr. Gauri Ashish Tadwar, and I am the compliance doctor, Dr. Sami Clinic, Ghatkopar East. Next, please. My research question is, does proper digestion improves to control sugar level in diabetic patients? So my question is very simple, but digestion, only the digestion is the root cause for the metabolic disorders, all the disorders related with the indigestion. So how to get rid from such a metabolic disorders. So I am going to present my case study. Next. So the patient is 58 years old, male patient, resided at Navi Mumbai. By profession, he is an engineer, and known case of diabetes since from last 5 years, hypertension since from last 10 years, and having indigestion issue since from 15 years. Next, please. So when patient came to the clinic, his medical data was, his BMI was 30.8, weight was 83.5, abdominal girth is 107 centimeter, pulse is 87, BP was 128 and 84, and allopathy medicine he was taking, TAP Tonac, 1 OD, that is statin, and TAP Obimet SR 500, metformin, TAP Amril, glimepiride, both are the anti-diabetic medicine, and TAP LN block 1 OD, and TAP Olmazest 40, that is antihypertensive. Next, please. Patient was not having any previous history, and at the time of treatment, patient having complaints in digestion, flatulence, bloating, and constipation. He was suffering from many GI issues, such GI issues. Investigations done by the patients, fasting and PP sugar, HbA1c, lipid profile, KFT, and TSH. Next, please. Investigations reports done by patients. HbA1c was 7%, estimated average glucose was 154, lipid profile, total cholesterol was 137, triglyceride was 163, which is borderline high, LDL was 69, and HDL 41, and serum creatinine was 0.9, SGPT 79, and TSH value was 4.63, which is borderline high. Next, please. So the diagnosis was diabetes, hypertension, and IBS. Next, please. So the Madhobag treatment given, concentrate on only diet, some oral medications, and exercise. So for 1 month given Prameha diet box, and patient was having GI issues, so suggested Alluri liquid and AVPC powder along with the diet box. And exercise also advised, that is morning walk only. So patient was doing brisk walk for 45 minutes daily. Next, please. So the weekly, I have done the compliance of the patients and given the follow-up. On the basis of weekly follow-up, in the first week, the patient's fasting sugar was 105, and the postprandial was 104. So the at the time, in the first week, I have stopped his Amril tablet, which is anti-diabetic, and the BP was 102 and 82. In the second week, the fasting sugar was 87 and the PP sugar was 111. So the other anti-diabetic medicine, that is Obimet SR 500, I have tapered to 1 OD, and the BP was 110 and 80 mm. In the third week, again the fasting sugar was 77 and the PP sugar was 102. So the same Obimet SR 500 mg, I have tapered to half OD, and the BP 110 and 70. So other anti-hypertensive medicine, that is Olmazest 40, I have tapered to half, that is 20 mg. In the fourth week, fasting sugar was 84 and the PP sugar was 112. So I stopped that Obimet SR tablet also, and the BP was 104 and 75 and Hg. Next, please. So the summary of the along with the diet box, patient also taking these two medicines, that is Alluri liquid 2 teaspoon TDS and AVPC powder half teaspoon 3 times before the meal. So in the Alluri liquid, it is the best medicine for the GI issues, which is this medicine contains Trifala, Trikatu, Pipali, Mari, Shunti, Ela, and the main contents is aloe vera. So it is excellent antimicrobial, anti-inflammatory, antioxidant, anti-diabetic, hepatoprotective, carminative, vasodilator, cardiac stimulants, having the properties. Thus, Dipan Pachan Dravyas in this medicine improves the Dhatvagni Madhya and overall metabolism of the patient. Hence, it helps to control on high blood sugar, high cholesterol, and high BP. Next, please. So the result after 1 month diet box. Yes, after 1 month of this medication and diet box, HbA1c reduced to 6.6, weight reduced to 78 kg, abdominal gut 102, and BMI 28. So the result is here: HbA1c reduced to 7 to 6.6. Next, please. As of now, the patient also giving the compliance of his vitals. So now his HbA1c was 5.9%, weight is 69, abdominal girth is 94, and the fasting sugar is 89, and BP is 170. So also I stopped his LN block tablet also. And now the patient is only in these two medicine, Tab Olmizes 10 1 OD and Tab Tonac 1 OD. And along with this medicine, he is taking Madhobag medicine also. And next, please. The conclusion is, in the view of this, we can conclude that patient was experiencing high blood sugar, high BP, and high triglyceride due to indigestion and poor gut functioning. Along with controlled diet box, Alluri liquid, and AVPC powder help patient to improve his digestion and gut functioning, which result into controlled BP, blood sugar, and triglyceride. And also he improved his sleep also. Thank you.
Thank you very much, ma'am. Any question from chairperson's side?
Very well presented, ma'am. No points from my side.
Thank you, sir.
Yes, good point, Dr. Gauri, and very well presented. Rudrog is Dhatu Dushti, and definitely the point what Hebbar sir and all the chairperson earlier have made. We should use a generic name, not a brand name, because the brand name what we are using in Madhobag is not well aware everywhere. So we should know the principle. We should know the generic, the content of the product, and your
Yes,
presentation should be in that way only. Anyways, good attempt. Next year, I am expecting a better presentation from your side.
Okay, sir. Thank you.
Thank you. Thank you very much.
Thank you, ma'am. And with your permission, sir, Dr. Nidhi Sahari madam is ready to present her paper with good internet connection, I think, this time. So can we allow her to present her paper?
Okay. Yes, please. Let's go fast.
Dr. Nidhi ma'am, please. Dr. Nidhi ma'am.
Hello. Am I audible?
Yes, you're audible but not visible.
Is it okay if I'm keeping my video off? Because I think there is some network issue still.
Yeah, it's fine. Let's get to the subject, and rather than slides, I want to hear the story.
Okay. Yes, sure. My case is management of avascular necrosis of left femoral head by Ayurvedic treatment. Avascular necrosis of hip joint has emerged as one of the most disable condition of person. It poses a challenge in front of medical fraternity due to non-availability of accurate management for this condition. Surgery offers hip joint replacement that is not so commonly available and expensive too. So my objective is role of Panchakarma modality in Asthidhatu Kshay. Next slide, please. The patient medical history. Here is a male patient with 43 years. He had complaint of radiating and pricking type of pain at left hip joint in the month December 2022. In 2021, he had history of blackish discoloration of skin of lower limb, for which he had underwent treatment under a skin specialist, and he got cured also. He had no history of fall or accident. But in the month of March 2023, I asked him to do CT of hip joint and lower lumbar spine. And here is, this is the CT scan report. The patient is complaining of pricking type of pain at left hip joint, which was radiating posteriorly till knee joint and anteriorly till the groin region with restricted movements, difficulty in walking, he was unable to stand from sitting position, faced difficulty while doing his routine job of farming, and difficulty in forward bending too. He had disturbed sleep for about 3 months. Next slide, please. Diagnosis is avascular necrosis of left head of the femur. Next. Treatment information. The patient was given initially with Ruksha Udvartan for 5 days with barley flour and wheat bran 150 grams and with Trifla churna. Diet given to him was low carb diet with zero oil diet and font of Dhanyak, Shunti and Shatapushpa for Vipan and Pachan. Chitrakadi Vati was also prescribed to him. Snehapan was done for 5 days with Bogrowth. After Snehapan, Snehan and Swedan was carried out. Snehan was done with Tiltail and with extract of Nirgundi, 25 grams, and Swedan was carried out with Dashamul Kadha extract, 15 ml in 3 liters of water, and Mudgayush and salad fruits were the diet recommended to him. Virechan was carried out later with 60 ml of castor oil, Shunti, Trifala churna with 2 tablets of erand brush haritaki. Peya was advised to him as a diet. Sansarjana karma was carried out for 7 days, Manda Peya Vileti for 2 days and then later on 3 days. Basti was given to him for 8 days, that is Tikta Kshir Basti, which consisted of 50 ml of Madhu, Saindav Lavan, and then Panchatikta Ghruta. Kalkab was prepared out of Guduchi, Yashti Madhu, and Erand Mula, milk was there. Diet given to him was Mudgayusha, salad fruits, low carb diet. Next slide, please. Next. Results. There was remarkable reduction in the pain. There was no radiating pain anteriorly. There was improvement in the range of movement at the left hip joint, and his gait was improved. He was able to stand from sitting position. He was able to drive his bike. He did not face much difficulty while doing his routine job of farming, and did not experience much difficulty in forward bending too. Next. Discussion. AVN of hip joint develops basically due to obstruction of small blood vessels supplying to femoral head, leading to gradual development of necrosis due to reduced vascular supply. Rakta becomes primary cause, leading to Asthidhatu Kshaya in hip joint. Udvartan was planned for external rukshan, as it would be the procedure of choice to remove avarna caused by kapha and mega. Virechan decreases Rakta Dushti, and also it is helpful in dhatu visodhan. Honey is the first component of Vasti, the base in which the emulsion for the other ingredients are prepared, and it is also said to possess Asti Sandhanya properties that helps in rebuilding damaged Asti. Vasti with Tikta Dravyas, Dhutta, and milk is indicated in Astikshajanya Roga. Guduchi is said to be an excellent rasayan drug known to prevent aging and degeneration of tissues, especially Asthidhatu. Guduchi is grouped under Asti Sandhanya Mahakashaya. It also has role in enhancing Raktadhatu. Erand Mool is said to have Vatshamak and Amadosh Nirharan, due to which there was a lot of reduction in stiffness, and there was improvement in the range of movement of hip joint. And this also provided nourishment in hip joint by rechannelizing blood vessels supplying to it. Next slide, please. AVN is an orthopedic condition which hampers routine activities and a big challenge to whole medical fraternity. The therapy in the current case provided marked relief from pain, tenderness, and improvement in the gait. Patient had sound sleep after the treatment. The grade of AVN did not worsen and was maintained. This Ayurvedic treatment of AVN is cost-effective, non-surgical, and needs no hospitalization. Thank you.
Thank you very much, ma'am. Very well presented. Any question from chairperson?
Yeah. One feedback is that after having gone through the lab investigation, if an Ayurvedic Samprati is drawn, and how you are going to break the samprapti with the Ayurvedic therapies, panchakarma, etc. If that is included in the presentation, it would become more wholesome. Otherwise,
Yes.
yeah, I mean, avascular necrosis is a huge problem, and congratulations on your success.
Yes, sure.
Doctor, very well presented. Very unusual
sir.
topic you have selected here, and you executed very well. Basically, you gathered all the data nicely, and the more important is if you can make this treatment as a protocol, definitely you can treat so many lot of patient in the future. And next
Yes.
year, maybe if you are coming up with like a 30-35 patients data with vascular necrosis, where you have used the same treatment as a protocol, that will be definitely very useful for to make some claim, as well as it will be very easy to propagate the science as well. So thank you very much for a very nice presentation.
Thank you, sir.
Dr. Nidhi, I will like to add upon कि starting something new, doing something new demands lots of courage. So congratulations to you. It is really very common amongst people, especially with sedentary lifestyle. AVN is very common and very difficult to treat, and the surgery is only option left. Otherwise, people have to live with very much pain and all. So you treated him, and you treated him well, and you presented it really very well. So congratulations. And we will like to move on our next presenter, that is Dr. Amol Harale, sir.
Dr. Amol, if you are driving, then
yes. No, sir. I am taken silent. I had parked my
Let's go fast.
car. Yes, sir. Yes, sir.
That's
Good evening.
No problem. Let's go fast and be clear. Yeah.
Yes, yes, sir. Good evening, all the dignitaries. I am myself Dr. Amol Harale from Madhobag OPD Mohol, which is in Solapur district, Maharashtra. It is a very rural area where I am practicing Ayurveda with Madhobag since from 3 years. My topic is, the question is, can weight loss plays a vital role in treatment of cardiac risk factors like type 2 diabetes mellitus, hypertension, and COPD, etc. It is a case study which I had treated last year in my OPD. The case history is 45-year female patient, known case of type 2 diabetes mellitus, hypertension, and COPD, came with complaints of hyperacidity, muscular cramps, constipation, and uncontrolled micturition and dyspnea on exertion. The weight was that lady is 72 kg, height is 148 centimeter, BMI 33, abdominal girth was 110 centimeter, BP is 140/90, and HbA1c is around 8.1 when she came to my OPD. My diagnosis is as per my question. Though she was suffering from type 2 diabetes mellitus, hypertension, and COPD, but I had selected it as a obesity because her BMI was 33. So I treated her as a obesity patient. Medicines for that, I use haritaki churn with processed with gomutra and kumari kotha, which is we said as a aluri liquid. And I advise her 800 kilocalories diet, low carb, moderate fat, and high proteins, which is we use to use the Madhav Shakti art also. I advise exercise, walking, and physical exercise, and to maintain musculoskeletal health, and as well pranayam for cardiopulmonary health, and omkar for stress management. That means I had used all the factors which are important in the management of the cardiac patients too. Ahar, vyayam, vishranti, and vichar. The results, whatever I seen, that are as like height is 148 before after, weight was 73 to 57 after treatment of 1 year. Huge difference is there. BMI fall down from 33 to 26, and abdominal girth is 110 to 95 centimeters. And VP is also becoming low because the patient was taking some allopathic treatment also. I tapered that, though her BP was 90/60 in last visit. Pulse and all the things are get normal. HbA1c reduced to 5.6 from 8.1. It is I had observed a huge difference in HbA1c too. Next slide. The clinical improvement she was complaining acidity, muscle cramps, dyspnea on exertion, uncontrolled micturition, cough, and mental status. She was lethargic. To now she feels energetic whole day, and the all the symptoms almost get normal after the treatment of 1 year. She had given good compliance to since last 1 year, and she is now the next slide, please. Patient was patient come to me, the patient was oral hypoglycemic agents, glycomed GP1, stopped within 2 months by tapering slowly. Antihypertensive drugs, that is S-amlodipine, stopped after 6 months. Now, since last 6 months, she was not taking any medicines for hypertension and any medicines for diabetes. Antihistaminic
Come to
bronchodilator.
conclusion, please, sir.
Yes, ma'am. Yes, ma'am. Within 1 minute. Completely stopped within 6 months. Constipation and uncontrolled micturations. These symptoms she get relieved. Next slide, please. The allopathic medicines are stopped. All the medicines, glycomed GP1, the mucolytic bronchodilator, antihistaminic drugs, all stopped since last within 2 months of the treatment, and the antihypertensive stopped since last 8 months. That means we have tapered all the allopathy medicines within 2 months and 6 months. Next slide. The conclusion of my case study is weight loss plays a vital role in management of cardiac risk. If patient is having high BMI, then we can treat the patients with weight loss management program, and the diabetes, hypertension, and dyslipidemia, COPD symptoms get relieved by that. This much is my case. Thank you very much for all the Madhavbag team who encourage us to present such type of case studies, and thanks all to all.
Thank you, Dr. Amol, sir. Now, any question from chairperson sir side? So,
nothing from my side. Well presented.
Thank you, sir.
Well presented, Dr. Amol. Saulya is one of the hardest disease to get to treat, and you did it very well. And basically, when you are correcting the Jatharagni, definitely the all rest of Dhatuvagni get corrected, and
Yes,
you got a very good result, fantastic results here. So all the best and keep it up. Thank you.
Okay, sir. Thank you very much, sir.
So the last presentation of the day, I would like to call upon Dr. Shalaka Patil ma'am to present her paper. Dr. Shalaka, you have to rotate your screen. You're looking. No. You have to rotate your screen.
Good evening all. Myself Dr. Shalaka Patil. My topic is effectiveness of ischemia reversal program pro in stable ischemic heart disease patient with evaluation of Duke treadmill score. Next. IHD is the leading cause of mortality in society. Though there is availability of extensive list of conventional therapeutic options, there is very little improvement in terms of morbidity and mortality of these patients. So there is need to establish an alternative line of treatment. Recent studies suggest that DTS is useful as prognostic and diagnostic investigation in risk patients of IHD. Next. So my objective is that the efficacy of an Ayurveda-based regimen IRP Pro as an add-on therapy to conventional treatment in patient with stable ischemic heart disease with CAD with evaluation of Duke treadmill score. Next. This is the formula for Duke treadmill score. More than or equal to 5 is of low risk, minus 10 to plus 4 is of moderate risk, and more than or equal to minus 11 is of high risk. Next. Next slide. This is patient medical history. 62 years male patient presented with history of post PTCA with TBD with IHD with past history of type 2 DM and HTN since last 20 years. In June 2021, patient underwent CAG, which shows tight mid-LAD lesion. After that, he underwent PTCA stent to LAD. After few months, patient started chest pain again. And in November 2022, his stress test was positive, which shows inferolateral changes. Patient again underwent CAG, which shows in-stent restenosis. And in diagonals, there was tight ostial lesion. Next. Patient presented with complaints of dyspnea with chest pain referred to left shoulder and left arm, palpitations, giddiness, tightness, and he was very depressed. Next. This is the report of first coronary angiography, which shows tight 95% lesion in LAD. Next. And this is the second CAG report showing in-stent restenosis, and in diagonals it has tight ostial lesion. Next. Patient assessment was done by clinical examination and with the help of investigations. HSCRP was 32, 3.2 in echo, hypertrophied left ventricle with ejection fraction 62%. Stress test was positive, showing inferolateral changes, and Duke treadmill score was minus 10. Next. My diagnosis was post PTCA with CAD, in-stent restenosis with IHD. Next. Treatment with timeline. Oral medication, Arjun, Vacha, Pathatvak, Punarnama, Jatamansi, Brahmi was given. Diet with low carb, low moderate protein and fat with high oxidation capacity diet was advised. And in Panchakarma, IRP Pro treatment, 7 sittings were advised, which consist of Snehan centripetal oleation, Swedan thermal vasodilatation, and Basti per rectal drug administration by drip method. Next. Next slide. And these are the results. After treatment, there were no complaints. Pedal edema was absent after treatment. Heart rate was decreased from 96 to 79 per minute. Blood pressure was improved from 180 by 80 to 147 by 70. Abdominal girth decreased from 104 to 88 centimeter. BMI decreased by 27.4 to 23. VO2 max improved from 15.4 to 25.9. Stress test was positive initially, having Duke treadmill score minus 10. After treatment, stress test was negative with Duke treadmill score plus 12.3. HSCRP was initially 3.2, which is improved after treatment 1.74. Next.
Come to conclude.
Next. Next slide, please. LVEF improved from 62% to 68% and with significant reduction in allopathic medication. Next slide please. This is the echo report before and after. Next slide, please. Mode of action. Snehan improves elasticity of vessels, reduce peripheral resistance, improves vascular tone. Swedan, that is thermal vasodilatation, reduces systemic vascular resistance. Vasodilatation at macrovasculature improves myocardial blood supply. Decrease in afterload, decrease in cardiac workload, reduces oxygen demand. Basti, that is Anuvasan Basti, improves intrinsic NO and offers extrinsic NO, which helps in improved dilatation of arteries. Decrease in oxidative stress reduces inflammation of endothelium, improves endothelial function and dilating capacity of coronaries. Next.
Come to conclusion, ma'am.
Yes. This is the Basti. Gokshur, it has nitric oxide mediated vasodilatory effect. Haridra, it proven anti-inflammatory, and Maliki reduces oxidative stress. Next slide. Many guidelines state that the score is validated tool for risk assessment of coronary artery disease and ischemic heart disease. Next. The findings of the investigation reveal significant improvement in Duke treadmill score from -10 to +12.3. There is reduction in HSCRP from 3.2 to 1.74 and in BMI from 27.4 to 23. The overall results suggest
Dr.
that an
Shalaka, please come to the conclusion slide.
when administered as an add-on therapy to conventional treatment, yes, sir, may effectively improve quality of life by improving DTS with improvement in blood pressure and significantly tapering conventional medicines. Next. Next. So my conclusion is an Ayurveda-based regimen IRP Pro is helpful in effective management of stable ischemic heart disease with CAD by assessing Duke treadmill score. Next. Thank you.
Thank you, ma'am. Any comments from chairperson side? So,
No, ma'am. Very well presented. Thank you.
Rahul sir.
Yes, thank you, Dr. Shalaka, for enlightening us with this beautiful results in terms of Duke treadmill score, HSCRP. The HSCRP reduced from 3 to 1.6. That is a remarkable improvement that you have achieved. Definitely, it's a good result. But when it comes to the presentation, we are repeatedly telling one thing again and again: don't use the brand name. Go with a generic concept. So what is IRP Pro? That has to be there in your title. So anyways, very good attempt, and all the best for your future presentation. Okay, thank you.
Thank you so much. Thank you, sir.
So once again, I want to remind our chairperson and Dr. Rahul sir, Dr. Hebbar sir, please share the marking which you have done as soon as possible so that we can finish this session, wonderful session. Meanwhile, you are sharing the marks. I would like to call upon Dr. Hebbar sir to guide us and what was his experience with us in this session. So if Sir Hebbar sir, if you would like to speak something, then please.
Yeah, I just sent you the marks list to you now, personal. And yeah,
Rahul sir, you too, please share the marks.
And congratulations everyone to everyone who has presented here. And you know, for some it is just the first presentation, and there will be some mistakes here and there. That's all good, as long as you get the courage to come to a podium and speak your voice. And another thing is that because everything is like a time constraint, you know, better to present it in the form of a story rather than just the numbers, so that at least if it is not educative, at least it turns to be entertaining, or it is educative and entertaining at the same time. And another one is that every disease is important, like IHD is important, and you know, avascular necrosis is important. It's just we can skip the slide. You know, globally it is important, and certain percent of people are suffering. We already know that. So just how the case was presented to you and what you did and what was the outcome. If that is presented, it's well and good, especially when so many presentations are lined up. My best wishes to all of you, and seeking blessings from seniors like Dr. Narayan Sarvare sir. Thank you.
Meanwhile, I am calculating, Dr. Rahul sir, you also shower us with some knowledge.
Yes,
And key point, any if you want to tell us regarding this session, regarding this, presentation,
yes.
so you are welcome.
So it's basically all the 13, 14 presentation what we had was very, what I'll say, the doctors, they took a very good effort to make a presentation, but it can be better if what Dr. Hebbar sir was trying to point out is when you are presenting a case, it should feel like you are telling a story, because you already experienced that, and you are going to share that experience with your colleagues. So you don't need to be get bothered, or you don't need to be get stressed out. You should enjoy your presentation, and then only the chairperson and all the audience, they will enjoy your presentation, right? There are so many presenters who really presented well, and they enjoyed their presentation, and we all felt that energy when they were presenting. We felt that they have enjoyed their presentation. This is why we are enjoying listening to them. So that's it. And you already did a good job in your clinical practice. Now you just have to tell the story in a very good informative way. And this is only, so anyways, it's a good platform to study, to understand, to learn. And definitely, as we will be progressing, maybe second National Ayurveda Cardiology Symposium, the next year we will be having a third National Ayurveda Cardiology Symposium. So the more and more research conferences you will be get exposed to, definitely that presentation and that part, definitely that will improve. The next important thing when it comes to the cohort study, or when you are showing some sample or the group data analysis, so be realistic. So you don't need to show only the improved cases average out. So this is not a research, because when you are showing that, it is practically, we all know, when the 50 patients are coming with the same kind of indication, it's very difficult कि मैं 50 के 50 patient मेरे एक साल तक मेरे साथ रहेंगे. Definitely उसमें से 10, 15, 20% patient will drop out. It's a natural law कि all patient you cannot continue it for the 6 months, 1 year. So you should show what was your dropout ratio, how much patient get dropped out, and you should also tell that and what are the parameter, why you use those parameter, what is the clinical significance of the parameter you used while when you are presenting a cohort. You should use a statistical test like small pair t test. It's a very easy to use pair t test. So this is how we can improve our retrospective observational studies as well as our case studies. And definitely I'm damn sure when we started learning Ayurveda, BAMS, we never thought of we will practicing cardiology one day. And today you all are doing wonderful in practicing cardiology. So definitely that day will come that you all will be the best of the best presenters, and you will presenting maybe at very international cardiology symposium with the best presentation skills. So don't worry about it. Sooner every day you have to make yourself you have to give a good, or you make some betterment in yourself. Definitely that will be helping you all a lot. So thanks a lot to Hebbar sir. I think you shown you all the patience. You are listening to all the presenters, and you have given your precious time and sharing your knowledge to all of with all of us. And especially thankful to all the doctors, the participants. It's almost a 9:45 here, and many of doctors still sitting in their clinics and listening to this informative session. So thank you all of you. And I think, ma'am, if you are ready with the
Yes. Results. Yes, I am ready with the results. So the everyone, you have presented really very well, and it is very courageous to give such a kind of presentation. Still, everybody was good, and marks are approximately at similar range. But still, the today's star is Dr. Lakshmi Narayan Sarbare sir. You were, you are the best presentator of the session 4, day 2. Congratulations, Dr. Lakshmi Narayan sir. Very well done.
superb. Someone please take a screenshot. Congratulations, sir.
And on behalf of Madhavbag family, behalf of all Madhavbag doctors, I want to thank both chairperson. You have given your very valuable time to us. You have given us, guidance to about presentation. So very thanks from Madhavbag family side. Thank you very much, sir. So I think it's time to switch off the system and let's take the rest. Good night.
Yes. Bye bye. See you tomorrow, everyone.
Yeah, definitely.